Welcome to America's Heroes Group.
With partner, Veteran Healthcare Policy Institute. November is Military Family Appreciation and Alzheimer's Disease Awareness Month. It's November 20th, 2021. I am Vietnam veteran host Cliff Kelley.
Yes, Cliff, it's always wonderful to see you. You're looking wonderful. His co-host, Colonel Dr. Damon Arnold. Our executive producer is Glenda Smith. Our digital media producer is Ivan Ortega of the Honorable Scouts Honor Productions. And he's doing a wonderful job here as usual. We have some esteemed panelists with us today from VHPI. Suzanne Gordon is VHPI Senior Policy Analyst, and her work expands over decades, reporting on healthcare programs, workers, policy, and she has authored and edited 21 books. I haven't done 21 of much things in my life, Cliff. Suzanne
and those you did, we may not want to hear about.
But Suzanne has written 2 books, The Battle for Veterans Healthcare and Wounds of War. And she has with her Jasper Craven, the VHPI Interim Executive Director. And today's discussion is going to center around VA telehealth during COVID. Hi, how are you doing, Suzanne?
Fine, thank you.
Good. Always great to hear your voice. And Jasper's on the line as well.
Yes, how's it going?
Great. Okay, Suzanne, tell us, what is about this, the VA telehealth
Hello?
during COVID-19? Hi, Suzanne?
Hello?
Yes, hi, can you hear me?
Yes.
Okay, yes. So tell me more about this VA telehealth during COVID-19.
Well, the VA has a vast telehealth capacity and has always been a leader in telehealth. And it has been recognized as a global leader in telehealth. And basically, when the COVID-19 pandemic hit and everybody had to go to virtual appointments, this was not very difficult. It was not very difficult for the VA because they already had this huge capacity. I wrote a lot about it in my book, Wounds of War. You observed, I once was in White River Junction, Vermont, watching a veteran get a physical therapy appointment with a physical therapist who was in North Carolina. Okay. Or I sat in San Francisco watching a veteran get an appointment for audiology, for hearing, with someone in Honolulu. So they have had this capacity, and they were able to very carefully pivot to telehealth to protect patients and staff from infection during the pandemic. Mm-hmm. But the problem is that under the Mission Act, the way they've interpreted the law, particularly the Trump administration, and now the Biden administration is continuing that, is that when veterans get a VA telehealth appointment at the Veterans Health Administration in-house, it doesn't count as access. And when they get it in the private sector, it does count as access. And so there's a double standard where veterans are discouraged from getting better quality care via telehealth at lower cost in the VA, and then the taxpayers paying for it in the private sector.
Oh, that's interesting. Yeah, that's.
So there's a double standard.
Yes.
And we are arguing that loophole needs to be closed. I don't know if Jasper wants to add something, but.
Yeah, Jasper.
Yeah, sure. I mean, I think just this whole issue that Suzanne has just described is really indicative of policy decisions inside the VA for the last 5 or 6 years, really from outside the VA, from Congress, writing sort of foolhardy or cynical legislation to sort of make it less easy for the VA to do what it's very good at. I mean, clearly, as we've talked about on the show before, the VA is contending with a number of different privatization policies, including ones that are specific for mental health care. And, you know, sort of telehealth has now sort of gotten wrapped up into all of this. And so, you know, this is a very sort of clear example because, as Suzanne said, like the telehealth capabilities of VA are unmatched anywhere else.
Yes.
VA has developed incredible technology to keep these virtual appointments compliant with HIPAA regulations. They've provided technology and sought to expand or you know, provide access to internet as well, so that vets in rural places can access telehealth. I mean, it's just billions and billions of dollars that have been spent here, and so then to see a far less effective system in the private sector, you know, hoover up so many of these appointments is very concerning.
Yes, yes. And how does that information even get back to the VA, you know, from the private sector? Because it seems like the other care that you receive in the VA, so if you go for other things, back complaints or for other workups or getting your medications and those kinds of things go through the VA, right?
Yeah, absolutely. And, you know, another thing that we hear about a lot is that there is really poor information sharing from the private sector. So there are all of these black holes that happen when a veteran is put out into a private sector appointment, whether that's through telehealth or mental health or any other sort of specialized appointment, which sort of breaks.
And what also happens is that the taxpayer is paying twice because we've made this investment in VA care and, you know, all these devices, all this infrastructure, and then basically that isn't being utilized, but it's being paid for, and then you're paying for it again in the private sector, you know, because you're paying for these appointments that could be delivered with a much higher quality at the VA.
Yes, and yeah, you know, nothing against them, but private providers don't even have the knowledge of what it means to be in the military. And, you know, the VA does have that benefit of people being familiar with the issues that are surrounding the veterans. So that seems like another loss as well.
Yeah, absolutely. I mean, there's ample evidence that shows very little proficiency in the private sector for veteran patients. And so really at the end of the day, this is about mostly money and privatization. And those are sort of, you know, the main topics that we focus on at Veterans Healthcare Policy Institute. And you can really find sort of similarly foolish policies, again, sort of across many different elements to VA services these days.
So on the legislative battlefront, what's going on with the legislative side now? Are there policies that are, you know, things that we need to watch out for, or are there things going forward to try to correct the situation?
Well, we really aren't seeing enough oversight by Congress, and so this telehealth issue is a place where Congress should be exercising its oversight because, you know, it's costing more money, and also we've tried to warn at VHPI about the fact that a lot of veterans in many areas are having to wait months to get a mental health telehealth appointment, which should be the easiest to access to get. I mean, telehealth is easier than scheduling an in-person appointment, and there's huge delays in these appointments in telehealth in the private sector, and that's because there isn't enough capacity in these different systems, and there isn't enough mental health capacity. There's a huge shortage of mental health providers. Because of COVID, there's been a run on a lot of people are having a lot of mental health problems because of COVID, and so there's a run on a short supply of mental health providers. Plus, there are no providers in, 55% of American counties, most of them rural, have no psychiatrist, psychologist, or social worker.
Yes.
49% of psychiatrists won't take private insurance, and they won't accept the rates that VA is offering, which is Medicare rates. So there isn't the capacity to handle this, and Congress did not accurately assess the capacity of the private sector to handle veteran patients, and it isn't exercising oversight to try to find out what's happening. I mean, we think there should be studies. I mean, we have a whole list of things that we think should be done, but one of the things should be somebody like the GAO or the VAOIG or somebody should be doing studies to see what's happening to these veterans in the private sector. The Congressional Budget Office just issued a stunning report about the excessive costs of the Veterans Community Care Program under the Mission Act, and the fact that it said under quality that basically the quality of private sector providers is not just unknown, but unknowable, because there are not granular metrics for you to find out about Joe Smith, that, psychologist, or Richard Ames, I'm making these names up, that surgeon. There's no data on individual providers. There's broad data on, how many deaths there are post-surgery for a hospital, but there's no data about an individual provider. So, this is all just the Wild West, and Congress could exercise oversight and isn't.
Yes. Yeah, and, one of the things that, one of my favorite quotes is, in God we trust, all others bring data. So if they can't bring the data to the table, I have a problem with my trust on that.
Yeah, that's very true. So what's being...
Well, I mean, what needs to happen is that somebody in Congress, or the veteran service organizations need to write a letter to the Secretary saying under regulation, this problem with telehealth can be solved through the regulatory process. And it also means that you need to have schedulers in the VA educated in what they should be telling veterans. And you also have to help veterans they should be asking for a telehealth appointment. They should be asking the VA, okay, you're sending me out to the private sector. What's the wait time in the private sector? Can I get a telehealth appointment in the VA?
Yeah, and imagine, there's so many different disparate systems out there in the IT realm. And I'm wondering, we look at cybersecurity and that kind of thing. I would imagine within the VA system, the data would be much more secure than getting it from 100,000 different providers that are sending you information into your system.
Well, they're not sending information, Damon. That's the thing. The VA cannot. They're not. So you send a vet out to the private sector, and we did a story on this. There was a survey by the Association of VA Psychologist Leaders, AVAPAL. People can go to its website, AVAPL. And also there was another survey that was done by the Nurses Organization of the VA, NOVA. You can go to their website. And basically they surveyed their members about the community care program, and they basically said they have no idea what happens to veterans when they go into the private sector. They're not getting progress notes and documentation back from the private sector. And basically Congress, because it didn't want private sector to impose any restrictions on private sector providers, hasn't mandated that in order to get paid, they have to send documentation, progress notes, et cetera, back to the VA.
Well, who's at fault there? Who should do what?
Pardon me?
Who should do what to correct that problem you're talking about?
Well, I think there's multiple problems that I think can be dealt with regulatorily. I mean, the secretary can, write regulations that say that telehealth counts as access. the Congress can require that private sector providers who are participants in the community care network give, as a condition of payment, and a condition of participation, have to abide by the same wait time and quality standards as the VA, that they have to, give documentation, that they have to work with the VA to coordinate care, that they have to have military cultural competency and use evidence-based practices for various problems, which we know that the private sector doesn't do. There are many fixes for this, but Congress has to step up to the plate and exercise its oversight functions, and also, make requirements on these people. I mean, they do it to the VA. They impose requirements on the VA. For example, everybody in the VA is trained how to do telehealth. They aren't trained how to do telehealth in the private sector.
Yes, right. And especially if you have a small office and, you don't have that kind of capability. And, and again, with the VA, at least you have a quality control on the psychologist, psychiatrist that you are hiring, right, to work with patients.
Yeah, absolutely. I mean, there's also been a lot of really interesting research that shows that telehealth is incredibly effective inside VA, including mental health, and that's largely because, as Suzanne said, there's just really intense training on how to transition onto an online model and provide care. And there's, a bunch of fancy technology as well at work, and patients can be given technology that can do vital readings and all of this stuff. So it's quite a helpful tool.
Wow. Well, we have about 2 minutes left. What I want you to do is, give us an idea of what do you think we as veterans should do. We should become more involved and get more involved in the different issues, or should we be going online, writing our congressional members?
Yes, I think that veterans and 10 letters to the secretary.
I think the Colonel's
10
right
letters.
on that. Yeah.
Hello?
Oh,
no,
yes.
I'm sorry. I was just saying that I think the Colonel's right on that. We need to send letters to our congressman.
And also to the secretary, saying
and
we want to, we want this double standard to be stopped, and you can, make regulations and send scripts to, schedulers, and that telehealth appointments should count as access. It says in the Mission Act that telehealth counts as an appointment, so you don't have to rewrite the law. But basically these regulations were enacted under the Trump administration, which was devoted to the privatization of everything, including the VA. So this needs to be fixed by the Biden administration. Because if the Biden administration doesn't fix this and veterans continue to get delays in treatment from the private sector, then the Biden administration is going to be confronted with yet another delayed care VA scandal, and this time it will be of their own making.
Okay. Yeah, that's really important for them to know that is, a major issue, because right now we still have veteran suicides at an all-time high, about 17 per day. And so those, those suicides that are occurring, can be prevented if people get adequate care. I know that there is a deficit in the number of people who are actually contemplating suicide, who actually get involved with the VA system. It's only a certain percentage of people get involved, but we need to have more of an outreach, and that needs to come from the VA.
It also needs to come from VSOs and veterans advocacy organizations and the media, because basically these groups, I think, are not telling people enough to go to the VA, and the media is, in my view, in like USA Today and even groups like Politico, they are participating in this crisis by putting out negative inaccuracies about the VA and discouraging veterans to go to the VA. Fox News, for example, has a lot of blood on its hands.
Yes, of course. Some of the things that they've been saying, that's really bizarre stories. But, one of the things, too, I was just thinking about is that this is, as Cliff was mentioning early, this is, November is is not Military Family Appreciation, but it's also Alzheimer's Disease Awareness Month. And Alzheimer's disease is also something that's helped by people who have a mental health background, psychiatrists and psychologists, and who's better to coordinate the care that someone receives as a veteran than the VA?
Right.
Absolutely. Absolutely.
Yeah. Right. So, give us some last
you
words.
have a system that we've invested in for over 70 years that knows how to do the job, and you're basically tying their hands and their feet.
Yes.
And they're shackled, and it's outrageous.
Yes, absolutely. So I want to really thank our partner, Veteran Healthcare Policy Institute. We just ran out of time, but we have got to get you back. This is such an important issue. Thank you so much, Suzanne Gordon, and thank you so much, Jasper Craven. But stay with us, stay with us. We are about to come and give you some really incredible information in the next shows.